Hello everyone, my name is Dunia Garcia and I'll be doing a critique on an article from my statistics and probability class. The article is Brilinta versus Plavix in patients with acute coronary syndrome. I'm going to be going down a series of slides to explain every information I gathered from this article. This article is a study between two platelet inhibitors, Brilinta and Plavix, in patients with coronary syndrome. The major exclusion criteria in this research were any contraindication against thrombolytic therapy, patients with an increased risk of bradycardia or a slow heart rate, and patients with associated therapy of a strong cyclochrome inhibitors. The purpose of this study is to compare the efficacy of Brilinta versus Plavix. My pick-up question based on this study is, are patients with acute coronary syndrome being treated with Brilinta at a higher risk of a recurrent cardiovascular event compared to patients with the same diagnosis being treated with Plavix? Brilinta and Plavix are platelet inhibitors that are used to treat patients with coronary syndromes. These medications are commonly prescribed to patients after stent placement to prevent thrombosis on the stent. This randomized double-blind trial shows the efficacy of the medications on the study and also points out the side effects in comparison with other medications used to treat the same conditions. The hypothesis. The null hypothesis is there is a relation between recurrent cardiovascular events and the antiplatelets Brilinta or Plavix taken by patients with acute coronary syndrome. Or the alternative hypothesis would be there is not a relation between recurrent cardiovascular events and the antiplatelets, either Brilinta or Plavix, taken by patients with acute coronary syndrome. To test this hypothesis, a multi-center double-blind randomized trial, the use of Brilinta or clopidogrel as a prevention of cardiovascular events were compared in 18,624 patients admitted to the hospital with acute coronary syndrome with or without ST elevation. Patients were randomly assigned to receive either Brilinta or Plavix corresponding loading dose. Patients undergoing percutaneous coronary intervention, the same as the cardiac cath, after randomization receive an additional dose of their study medication at a blind fashion at the time of the percutaneous coronary intervention. The patients undergoing bypass surgery, same as GABG, it was recommended that the study drug to be withheld in patients taking Brilinta 24 to 72 hours before the procedure and 5 days for patients that were taking the Plavix or patients on the Plavix group. The results. After 12 months on the study, cardiovascular events on patients taking Brilinta had occurred 9.8%, while patients taking Plavix had an 11.7% of occurrence, but no significant bleeding was found. Conclusion is that patients with coronary syndrome treated with Brilinta compared with Plavix significantly reduced the rate of death from cardiovascular causes without an increase in the rate of overall major bleeding. The population. Based on this study, the population of will be all the patients with acute coronary syndrome, and then the sample will be the 18,624 patients. The variables. We have the independent and the dependent variable. In this study, the independent variable will be the medication Brilinta and Plavix, and the dependent variables will be the patients on the study, 18,624 patients. The hypothesis. The null hypothesis in this study is that patients with acute coronary syndrome or CAD treated with Brilinta have less chances of a recurrent cardiovascular event than those patients taking Plavix. The alternative hypothesis in this study will be that there is not a major significance on the recurrence of cardiovascular events on patients with acute coronary syndrome or CAD being treated with Brilinta or Plavix. Pretty much that there's no difference. We go down the measurements, levels of measurements. For nominal, I have patients with acute coronary syndrome. Ordinals, then I have the secondary efficacy and the primary efficacy. The primary efficacy will be the time for the first occurrence to take place of a cardiovascular causes from the moment that the patients started the medication, and the secondary efficacy will be the type of cardiovascular event, a little bit more in depth on the study. Then we have that the ratio measurements is the 360 days for the period of the first and second randomization. Sampling procedure. In this study, Valentin, which is the main researcher on the study, this study was done in 2009, recruited 18,624 patients from 862 centers in 43 countries from 2006 through July 2008. The follow-up period ended on February 2009 after the information on vital status was available for all patients. The two treatment groups were balanced based on the medical characteristics. Patients were randomly provided with medications and put into corresponding groups. Patients' visits were scheduled 1, 3, 6, 9, 12 months after the initial treatment. Besides the efficacy of the medications, side effects and adverse reaction, as well as high risk of bleeding, were factors also studied on this research. The data analysis. The data was analyzed based on primary and secondary endpoint. The primary efficacy or primary endpoint was the time to the first occurrence on combination of death from cardiovascular causes that the patient had started on the treatment. The secondary efficacy or secondary endpoint analyzes the causes of death on patients from the primary endpoint and the combination of deaths of any patient in the study, being from cardiovascular related problems or not. The two randomly selected treatment groups on this study were separated based on the antiplatelets that they were being treated with, and the patient's characteristics were studied to eliminate difference in the groups. Other treatments comparations were examined in exploratory manner until non-significant differences was found between the two treatment groups. Findings. After 12 months on the study, cardiovascular events on patients taking Brilinta had occurred 9.8%, while patients taking clopidogrel had an 11.7% of occurrence. The treatment with Brilinta, as compared with Plavix in patients with acute coronary syndrome or CAD, significantly reduced the rate of death from vascular causes. The beneficial effects of Brilinta were achieved without significantly increase on major bleedings. The treatment effect was the same in the first 30 days as well as for the rest of the year. The duration of treatment benefits was also demonstrated with Plavix, but Brilinta appears to have more benefits. The incremental reduction in the risk of thrombotic events is more consistent with the treatment of Brilinta. And since Brilinta is an inhibitor that has reversible effects, the antiplatelet effect dissipates more rapidly than those antiplatelets with non-reversible effects like Plavix. Dyspnea or shortness of breath occur more frequently with patients taking Brilinta than Plavix, but most episodes lasted less than a week. The superiority of Brilinta over Plavix with regard with the primary endpoint and the bleeding rate was consistent with the majority of the subgroups in the study. The protection of the human rights on this study. The Executive and Operations Committee, consisting of both representatives of the sponsor AstraZeneca, designed and oversaw the conduct of the study, or the trial. The complete trial, including the unblind data, was being monitored by independent data and safety monitoring board and collaborations with investigators and the academic center and the sponsors. A statistical analysis was performed by worldwide clinical trial and contract researchers organizations. The study design was approved by the appropriate nation and institutional regulatory authorities and ethics committees, and the participants provided written consents. The budget is outrageous. Prices is extremely high for a trial, specifically this trial that was based on 18,624 patients. We got this big number, $666 million. It was the budget. The reference for this study, it was based on 32 confirmed references. The author provided all the researches at the end of the article, and it was mainly from 2001 to 2007. The reason I chose this research is because I have been working as a medical assistant at a cardiologist clinic for several years, and I've seen firsthand the response that patients have to Brilinta, and I have been a witness to what the research showed. Selecting this article was really not difficult for me. I wanted to look more in depth on how the process of such an important critical trial was and the details on it. Unfortunately, many patients are not aware of the benefits of many medications, including Brilinta, because of the elevated cost and insurance coverage. The budget was a lot more expensive than I saw, and overall, my thinking process was inclined towards both the mathematical and the analytical, which I found very peculiar while doing this assignment. This is my presentation for the critique of this article. I hope you guys found it interesting, and if you have any questions, thank you.